Hi, ladies and gentlemen. I'm Dr. Fazil. You're watching July 2025 Dr. Fazil TV show. So, folks, the topic of discussion today is stroke. Is a very common medical condition. As you know, I'm also an internal medical specialist, a kidney specialist as well. But let's focus on the internal medical side today, which is what is a stroke and symptoms, how can you prevent it, what are the bulk of the treatment. Obviously, you can discuss with your primary care specialist for more information. It is just for information only. So welcome to Dr. Fazil TV show. So I'm going to also, as usual, use some holograms in my discussion so I can explain better. I think it's easier to use those tools so you can get a better understanding what does it means, whatever it comes to medical terminologies and situations. So folks, the stroke is a broad term. It is used when people have weakness in the arms, legs, or whole one side of the body, right side or left side. It depends which part of the brain is damaged. So folks, the stroke means there's a dysfunction of the portion of the brain, and that could be due to a bleed. So let's bring up this hologram. You can see this is the brain. So this is the skull right here. Inside the skull there are three layers of protective layer. We call them meninges. Inside there's a soft tissue of the brain. And again, this is kind of like a general layout. So let's park this hologram right here for now. So let's move on to the two kind of stroke. There's one is ischemic stroke. Ischemic stroke means no blood going to the brain, and hemorrhagic stroke means too much blood going to the brain. It's like a bleed inside the brain or outside the brain, right? So outside the brain we call it subdural hematoma. I'm going to bring up another hologram. You can see there's a bleed and it is outside the brain and it's compressing the brain inside. It is known as subdural hematoma. That happens generally if you're on blood thinners or not, but if you have a trauma to the brain from the head injury, or you have an extreme high blood pressure, it can bleed either inside the brain or outside the brain. Let me bring it another hologram, and you can see there's a bleed inside the brain right here. You can see in this spot right here. Let's park it right here. So now we understand there's the bleed kind, which could be more aggravated or easily done if you are in advanced age, because the brain becomes smaller. There's more space between the outer part of the skull and like inner part of the skull and the brain. So the brain can wiggle more than normal, and it can cause a tendency for the bleed to happen. Again, the bleed will happen mostly if you have a very high blood pressure and the artery just burst open and cause bleed. And depending on which part of the brain is affected, it's like a computer, and it have nerves which goes to a different portion of the body, starting from the face, arms, legs, and obviously and also the balance portion of the stroke as well. So if you feel dizzy, and again, let's bring another hologram, and you can see there are different part of the brain: the frontal lobe, the parietal lobe, the temporal lobe. There's an occipital lobe in the back. Each lobe represents different portion of your body. So it's kind of opposite. So right side represents the left side represents the right side. So folks, when you have a bleed in those areas, it depends how big the bleed is or how many parts of the body is being involved. You will have symptoms, either numbness, tingling, or weakness, and in an extreme case you can pass out too. So it can affect your face, facial droop. Symptoms would be facial droop, unconsciousness, slurred speech, vertigo, dizziness, not able to walk in a straight line. Also, weakness in the arm, hand, or leg, on generally one right or the left side. In extreme cases, it can happen both sides, and then you can pass out, go to coma. So this was like a bleed stroke. So the bleed stroke is treated differently. You don't give any blood thinners. As a matter of fact, you stop that, control the blood pressure. So that's kind of differently. So basically, the treatment prevention would be obviously control your risk factors, make sure you have a trauma, or if you think you might have a trauma, make sure you go to get checked out. Generally, they do a CAT scan, CT scan of the brain. Let me bring it up, another hologram right here. You can see, the CAT scan is showing a bleed pushing the brain inside. So that's how they diagnose. And the treatment is sometimes they make a little hole inside the skull and drain the bleed. If it's superficial, if it's deep, then obviously they just do risk factor management, like lower the blood pressure, stop the blood thinners, and physical therapy, physiotherapy, those kind of things. So let's talk another kind, which is ischemic stroke, which is most common than the bleed stroke. So let's bring up this another hologram, and you can see there's a little spot in the middle of the brain which has no blood supply. And again, the treatment is different, and the causes are slightly different as well. So let's talk about the symptoms. Symptoms remain the same. So we discuss about the symptoms. The symptoms of the bleed stroke and the ischemic strokes are pretty much the same. The treatment is different.
The Dr. Fazil Show is now available to view at home on Roku devices and YouTube. Catch up on your favorite episodes right on your phone, available on YouTube and the BioFamily Clinic app. The Dr. Fazil Show is available in many doctor offices across Yuma, Arizona. Pick up your free copy of Health Tips magazine, available throughout Yuma, Arizona, or read our digital version at healthtipsmagazine.com.
So in the ischemic stroke means lack of blood supply to a portion of the brain. It can cause blindness, dizziness, vertigo, difficulty to walk in the straight line, even a memory loss. And both stroke can cause memory loss too, right? Dementia is also, repeated stroke can cause dementia, loss of memories as well. And, weakness in arms, legs, and it could be permanent, it could be temporary. Now, in ischemic stroke, it could be temporary. We call it mini stroke or TIA. That means symptoms come and go. So that is known as TIA, but that's the warning sign. If you're having TIAs, then you need to be seen immediately by your provider, so they can intervene before it gets to the major permanent stroke, right? So, like temporary stroke comes and goes, and then you just kind of like, and sometimes it doesn't go and become permanent, right? So, folks, the causes of ischemic strokes are like atrial fibrillation, like your heart is fibrillating, and most people don't have symptoms. So generally that's how they start. They end up with a stroke. You do investigation, find out the heart was fibrillating. I'm going to bring another hologram. You can see there's the four chamber of the heart on the top, at the bottom. Bottom one is fibrillating instead of contracting normally. When it fibrillates, blood tends to make a clot because it's not moving, and then it can move. In one fashion, the clot can dislodge and go from you can see it going to the carotid arteries and to the brain and cause stroke. So atrial fibrillation, also the hypertension. Hypertension, uncontrolled diabetes, uncontrolled hypertension, uncontrolled cholesterol, are major risk factors for stroke. Family history to some extent, obesity, obviously. Those kind of things cause plaque buildup. Let's bring another hologram here. You can see this is the artery of the carotid artery right here. On each side, the carotid artery is in the front, vertebral artery in the back. So they start to build up plaque. So it can cause dislodgement of plaque, and plaque can go up. Plaque is actually a gunk or junk, from cholesterol, and it can cause, a dislodgement into the brain and cause stroke, ischemic stroke, right? So those are the major causes. Sometimes you can have a stroke during the procedure because of blood pressure fluctuation with anesthesia, or doing any intervention on your carotid arteries, and it can dislodge your the plaque into the brain and cause major stroke. So, folks, that's the symptoms, signs, different kind of strokes, and then, the question is what we can do to prevent it, right? The prevention is the key here, because once you have it, you cannot come out of it. It is permanent damage. The brain does not regenerate, Unfortunately, like other tissues, the brain does not regenerate. Once you have it, you have it. So you will recover to some extent, but you're going to have some loss of your mental capacity, or power, obviously. So you don't want that, right? So basically, the prevention is depending on I can summarize it. The prevention would be like if you have risk factors like Check your blood pressure, make sure it's less than 140, 190. Sugar, diabetes should be controlled. Your hemoglobin A1C should be 7 or less. Check your cholesterol. The total cholesterol should be 200 or less. Obviously, we can talk more into details in the next session, but this is the kind of gist of it. And then obviously losing weight, keeping your body mass index, which is like your weight to height ratio should be 25 or close to 25, at least less than 30, right? The obesity is the root of a lot of problems. High blood pressure, diabetes, high cholesterol, all that can cause stroke. And if you do have an atrial fibrillation, or you think you might have it, get checked for that, because that is a very, very common cause and very dangerous source of multiple strokes. Like you can have a shower of strokes with atrial fibrillation. And the treatment remains the same, except in this case, you add a blood thinner to prevent it with the aspirin, maybe adult aspirin, or sometime if you have atrial fibrillation, like stronger kind of blood thinners, folks. So on that note, I will call it a Dr. Fazil TV show, end of my show for this month. We'll see you again next month with more information on another useful topics. And God bless you, God bless America, and thank you for watching Dr. Fazil TV show. Thank you.